All right, well, good afternoon. I'm joined today by two fine medical students from the Wayne State Medical School, Lucia Wong and Michael Montman, who have been a huge part of our response to COVID-19. I'm going to give them an opportunity to talk about their contribution. They're typical of the way so many people in this community have pulled together. And also I'm joined today by Rick Szostak, the Executive Vice President of Honda North America, with a pretty major announcement for people in this community who don't have transportation and want to be tested, and of course with Denise Fair. We're going to start, as we always do, with the numbers in this community. And as of noon today, we have lost 1,111 Detroiters to COVID-19. The number is growing much more slowly than it was before, but it is no less painful to the people in this community who are fighting this disease. As always, I will show you on the chart where we stand. 100% confident on numbers because the state, I think as you know, their data site was down for a couple of days, and so we're still only going to take numbers through Saturday, May 2nd. I'm not confident yet on the Sunday and Monday numbers, but even there, you can see what's happening. And we've gone from 236 deaths 4 weeks ago to 277 to 232, down to 147 last week and 66 in the last 7 days. And the numbers continue to drop almost by the day. The number of patients on vents in hospitals are continuing to drop. And I just talked to Lynn Terosian over at the TCF hospital, where those 1,000 beds have 3 patients in them and 997 vacancies. And again, it's a tribute to what the people of this city have done. So the key to everything that we have done has been testing, and I think by now you know I've been obsessed with it, and we're doing 1,000 tests a day at the fairgrounds, but we're doing 250 to 300 tests a day with the Abbott 15-minute tests, and it was the key from the Detroit Police Department, going from 600 officers quarantined at one time to getting the department back to full strength, getting our bus drivers, getting our firefighters back. They also were the ones who did the 2,000 tests on nursing home residents. And this has turned out to be the biggest tragedy in this country, is the way patients in nursing homes have died. And we've talked about it many times that a significant number of patients in nursing homes are infectious and are not showing symptoms, making it impossible for directors of nursing homes to know how to separate the infectious from the non-infectious. And so what Denise and her team did, which was pretty remarkable, was we could not have effectively transported 2,000 seniors over to our health department for the 15-minute tests. And so what we did was get a team based out of Henry Ford to go through the 26 nursing homes, swab the patients, and then well into the evening, after our officers and others had been tested during the day, we had a team, largely medical students, who tested many times well into the evening. And the reason that we are making real progress at our senior centers is because of their dedication. And so they were medical students who were supposed to be doing rotations through hospitals at this point in their education, and instead they have been saving lives, and they've been doing it hour after hour at the fairgrounds, at the Abbott site. And so I want you to get a chance to hear from them, get a sense of the kind of people pitching in. So we'll start with Lucia Wong and then Michael Montman, and you can talk about how you got engaged in this and what you've been doing.
My name is Lucia. I'm a rising fourth-year medical student at Wayne State, and I want to be an infectious disease doctor. As Mayor just explained, we were pulled out of rotations in March because the hospital wanted to conserve PPEs for the nurses and the doctors. So like many of like the hundreds of med students, we started looking for opportunities to volunteer. And so I happened to be volunteering at the fairgrounds, and then I was called to volunteer in the rapid testing at the Detroit Health Department. And this has been the most wonderful opportunity I could possibly have had. I am going to medicine for infectious diseases, so I thought that I wanted to go to help to learn about the virus, to learn about how to treat. But the surprise was I learned something more important, that was learn how the city comes together for something like this, how the health department do alliances with like, for example, the Global Health Initiative of Henry IV, how the city come together to feed the volunteers, I mean, that was just beautiful. And the other thing was that we got a crash course in public health, and then we got to interact with all the first responders. I mean, the first responders, policemen and paramedics, bus drivers, everybody has been so receptive to us, the students. They have been thankful, and we always feel bad because I feel like they are the true heroes. They are the ones that go out to the street. They are the ones that risk their lives. And they have been very candid. They share their experiences with us. They share the sacrifices they make and the risks they take. So I think just meeting them and talking to them in this different setting has been one of the most rewarding things, that I experienced.
Lucia was the person who gave me the good news that I was negative, so that was a definite highlight. Michael, go ahead.
Yeah, sure. I'm a rising third-year medical student at Wayne. And when we got started in this, it was I was just about to head into clinical rotations, but that got canceled. And so after having a few weeks to be off from school, getting this opportunity to do this and to be useful in a way that I could be useful, was just great to get involved with. It's really been a great learning experience and still have that clinical interaction with people, even though we're not in the hospital. Still get to talk through the worries people have, whether they test negative or positive, and get to hear all their concerns and reflect empathy and just practice those skills that go into making us good doctors. And I think that's something that Wayne State students are going to be really good at by the end of this. We were good at it before. I think this is going to make it easier to learn those skills and make us better doctors in the end. So, volunteering and community service is a really big part of our experience at Wayne State Medical School. And so being able to keep that part of our medical education going and to really be able to help out in this crisis has been, it's been a good use of my time and learning experience, and hopefully provided some benefit to the city. So
You've been great, and President Roy Wilson has made sure that Wayne State University has been a huge asset to the city in fighting this in so many different ways. And I wanted the people of the city to get a chance to hear from a couple of the many volunteers from Wayne State. But you have done great work, and thank you for what you're doing. And we're going to have to continue this a little bit longer, but we're gaining ground on this virus. One of the big accomplishments is what's happening at the fairgrounds. We're now doing more than 1,000 tests a day, and once we got it up and running, it wasn't very long. As I was saying to the people of the city of Detroit, I want every single person in the city who needs a test to be able to get a test, regardless whether you have health insurance, regardless of your income, regardless of whether you have a car. And in order to do that, Mark DeLaverne and the team set up an outstanding transportation system. Gary Torgo from TCF Bank made a very generous financial contribution, and we've been doing $2 rides, the same as it would cost you to ride a DDOT bus. And we've had 4 cab companies, Checker Cab, Lakeside, Bright, and Odyssey Transportation, who have been providing the trips to the fairgrounds for people who don't otherwise get there. And the numbers have been growing. We had 40 yesterday. We're now running more than 200 trips a week to the fairgrounds of individuals who don't have cars but need a test. And you can understand that the cab drivers, while the patients have their masks and the cab drivers have their masks and there's intense cleaning protocols between each trip, the cab drivers sharing that enclosed space, that airspace, has been a source of some uneasiness. But it was the best that we could do. And then Honda stepped forward and they heard about what we were doing and said we could do even better. And so Rick and Honda North America retrofitted 10 vehicles where they not only separated the front and the back physically, but they set up air handling systems so that the air didn't move from the back to the front, so the drivers could make one run after another and not have to worry that they were breathing the same air as an infectious patient they might be transporting. And so these 10 vehicles will be put on loan to the 4 cab companies for the duration of this epidemic, and it's going to make it so much easier. And I say to anybody, and you know who we're testing now, anybody who is going to work in an essential job in Detroit, your company should have called up by now because we want to get everybody tested who's working. Of course, everybody tested who has a prescription, and before long we will be moving on to anybody in the city who wants a test. But when you call and get your appointment, if you just tell the Quicken operator that you need transportation, they will click you directly through to the cab companies, and you will be transported in these new Honda vehicles. And with that, I'll turn it over to the man who made it possible for us here today, Honda Executive Vice President Rick Szostak. Rick?
Well, thank you, Mayor Duggan. It's great to be here in Detroit today. You know, the project that we're talking about is one of many initiatives that Honda and our associates are doing to support communities across America during the pandemic. So after we received the request from your city, Mr. Mayor, a team of Honda engineers and fabricators at our Research and Development Center in Ohio quickly sprang into action. They quickly came up with a method to modify our Odyssey vehicle, and in less than 2 weeks, they completed the fleet that we have here today, a fleet of 10 Honda Odysseys. I want to thank them for their dedication to the task and the great result that they achieved. So, Mr. Mayor, today I'm proud to represent Team Honda and deliver these new Odysseys. There's 10 of them sitting right in the parking lot outside. Vehicles that were proudly made in Alabama. They have Honda transmissions that were produced in Georgia. As I just mentioned, they were specially modified in Ohio, and these are to serve the residents and the healthcare workers of Detroit. We're in this together, and Honda stands with the Motor City and the rest of America to help solve today's problems. Thank you very much, and we're so delighted to be here.
So the video is showing right now, and you can see what's being done, and this is the most positive thing to come out of Columbus in quite some time. So we are really pleased to have this, and I think there'll probably be an opportunity for some media.
Did I hear you say one of the cab companies is an Odyssey cab?
It is called Odyssey. They don't
they
even
ought to
need
get first dibs.
change
Yeah.
the nameplate on the vehicle. So Odyssey Cab will be driving the Honda Odyssey. So there was some foresight there. But this is the way the country has come together and supported us, and it seems like it's another national and international partner that does it every single week. But a big part of why people want to support us is the way that we are handling ourselves here. And if you've seen some of the drama in Washington, in Lansing, in the coming weeks, it is not reflected well. And those who were here in the city of Detroit in 2011 and 2012, the last time the city of Detroit was dealing with big deficits, there was a lot of behavior that was embarrassing, and there was a failure to deal with the financial issues. But a few weeks ago, when I laid out a plan to cut $348 million out of the budget, because we are never again going to let somebody come in here as an emergency manager and take away self-determination from the city of Detroit. We actually had submitted a budget to city council before that, and we had to announce that in addition to the $150 million being cut from this year, they were going to have to cut $194 million from the budget that had already been submitted. And Dave Masseron, our CFO, has done an excellent job. Tanya Stoudemeyer, our budget director, is as fine a budget director as there is in America. But to say to them in the middle of the process, you have to shift gears and completely redo the budget. And by the way, we are going to protect the retirees on their pensions. We are going to protect the police, fire, EMS services, and bus services. And we're going to have to take the cuts from the rest of the budget. It won't be easy. There are some hard decisions. And I wasn't sure what was going to happen. But Council President Brenda Jones, who will be joining us tomorrow, she had a commitment today, but she'll be here tomorrow to talk about it, ran an extremely professional operation. None of the kind of drama that you're seeing in other places in politics. They got down to business, and the chair of the Budget Committee, Janae Ayers, just set a tone from the beginning that said, if you want to talk about changes, I want to talk about cutting more, not cutting less, because we're going to preserve Detroit's self-control, and just did a wonderful job. And so earlier today, on a 9-0 vote, the budget that Councilmember Ayers got through her committee was adopted by City Council. And the disagreements we had were professional disagreements over which money should go where, and we worked them all out together. No name-calling, no histrionics, just professionalism. And we have now a budget adopted starting July 1st, the 2021 budget, is we have a balanced budget. If this pandemic continues longer than the end of this year, we're going to have to make more cuts. If things ease earlier, we may be able to restore some things. But right now, we think we have a very conservative approach. And in her night or her spare time when she wasn't running the Budget Committee process, Councilmember Ayers has been out on the fairgrounds day after day directing traffic. Just a real jewel of this community. So let me turn it over to Councilmember Janae Ayers.
Oh, thank you. So you pretty much hit the nail on the head on all of those fronts. I just want to take an opportunity to thank my colleagues, because if it weren't for the 8 other council members being very diligent and being very efficient and effective in what we had to do, we would not have been able to get this accomplished. Outside of that, I do want to go back and say again to Dave Masseron, Tanya Stoudemeyer, Donnie Johnson, their whole team. They are absolutely amazing. Our Legislative Policy Division, Mr. Corley, Irv Corley, has done an amazing job. We're talking about people that dedicated 24/7 to making sure that we all had the information that we needed, as well as Beth Niblock and her team would do it, because we were able to get our media services. We were able to switch to something that we had never done before. This is the first time a council has ever had to virtually go through a budget process. And so I do want to thank all of those folks, and anybody whose name that I didn't call, please charge it to my head, not my heart, because I appreciate each and every one of you. Media services, I see you back there too. Thank you. This is what it looks like to want to be collaborative. This is what it looks like to want to move your city in the proper direction. This was a team effort between the administration as well as the council. And to the mayor's point, they're not everything that we agreed on, absolutely not. It's hard to make decisions, but we were elected to be leaders. And so, in my opinion, when you lead, you don't lead for the moment. You lead for the direction that you want your city to go in. And so we started, at least in my 5 years on council, a trajectory of moving forward. And that is what I believe Detroit is going to do, is what Detroit continues to do, is what Detroit has always done. And so I thank the citizens of Detroit for being participatory in the process. Thank you for their patience, because it's a hiccup trying to go from shuffling papers in a committee meeting to moving everything virtually. What I expect, and I hope that happens from this, is that the tone is set for people to become more engaged in what it looks like to have a budget process. This it's been rough. It has been rough. There are no qualms about that. But the bottom line was to make sure that the citizens of Detroit still didn't miss out. You still deserve to have your trash picked up. You still deserve to make sure that the vacant lot that may be next to you gets mowed. You need to make sure that we have our public safety and first responders fully staffed and working and healthy to be there. And I think that we were able to accomplish that in this budget process. So to all that were involved, thank you. And to all that may not have had a chance to participate, we'll have several other budgets and several other opportunities that I hope that you take advantage of. But thank you, Mr. Mayor.
Thank you, council member. And, you know, this has not been as painful as it might have been, because in the last few years, when we had a lot of companies coming back and revenues were coming in well ahead of what we had projected, the city council had the foresight to support us in setting aside a significant rainy day fund and a significant reserve. And so we're not cutting police and fire as we have in past recessions, because we had been preparing, and council leadership really was visionary. And with that, I'll turn it over to our health director, Denise Fair.
Thank you, Mayor. Let me first acknowledge the Wayne State students. It's been really wonderful working with them. We could not have done any of this without their support, and they've been working closely with the health department and making sure that our frontline workers are returning back to work. Since we opened up the clinic on April 3rd, we have administered almost 6,000 Abbott tests. This includes 2,100 tests from our 26 nursing homes in Detroit, as well as 3,600 tests for the city's first responders. Again, this is incredible, and thank you very much to the med students at Wayne State University. Now, yesterday, I was unable to provide an update on the COVID-19 cases because of the state's technical challenges. However, the issue has now been resolved. So today, the number of confirmed cases for Detroit is 9,449 cases, and as the mayor mentioned, 1,111 deaths. Now, although we've done an incredible job at slowing the spread, we're still losing our neighbors, and this continues to be hard for all of us. We are now shifting gears and focusing a lot on our nursing homes and long-term care facilities in order to mitigate the virus. Now, recall that there are 37 facilities that have confirmed COVID-19 cases, and we are starting to test those sites first. As of today, we've completed testing at 23 sites, and as I mentioned yesterday, we are seeing an infection rate of around 10%. We plan to continue testing, and we will complete our goal by May 15th, or even earlier. As the health department, we are first and foremost committed to the health of our residents. We will continue to advocate, to be transparent, and share information to ensure our community's well-being throughout this pandemic. And with that, I'll turn it over to the mayor.
And we'll take any questions.
Good afternoon, ML Elric, Detroit Free Press. Mr. Szostak said that the city had approached Honda about donating some vans. Had you talked to all the automakers, or can you tell us how that process worked?
I talk to everybody every day, but Rick, why don't you talk about the history,
Genesis of this.
company?
Absolutely, Mr. Mayor, happy to answer that question. So this follows a program that we had done in Japan, in Tokyo, Japan. So that was done earlier in the month of April, and that was reported in the media right around the middle of April, I think April 14th or something like that. And basically the same process in Japan. One of our engineers and again, we're talking here about Tokyo, a mega city that relies on mass transit. So again, a difficult problem of getting people safely to a testing site. It's the same problem in Tokyo, Japan, as exists here in America. Anyway, one of our engineers in Japan had the idea to try this out. They actually did it with an aluminum barrier as opposed to a polycarbonate barrier. And then, as the mayor was describing, the air differential, it's important to have more air pressure in the front of the vehicle than in the back of the vehicle, so modified the ventilation system, and it worked. So there's a small fleet of, it's not the same vehicle, the Odyssey is only sold here in North America, but a different vehicle in Japan. There's a small fleet of those with various municipalities in Japan. Anyway, that was reported. The mayor's staff saw that reported and called us up and said, "Can you do that here?" And we said, I think we might be able to. Let us give it a try. And 2 weeks later, they're done, and the vehicles are here. So it really follows the model of a program that we did in Tokyo, and we're so happy to be able to, so happy that the city of Detroit called us, and happy to be able to respond.
And are there other American cities where you're doing this or have plans to roll this out elsewhere?
Good question. This is the first, this is our pilot program, the first time we've done this. So we've got this fleet of 10 Odyssey vehicles out there. You know, Honda's very customer focused, and when I think about this application of this vehicle, I think about two customers. I think about the driver, and I think about the passenger. And we want to keep them safe and do a good job for them. So we'll be looking forward to quick feedback on how this is going here in the city of Detroit, and we are definitely open to speaking to other municipalities about similar opportunities. And by the way, there's nothing, I would say, so special about the Honda Odyssey minivan. It is a darn good vehicle, and it's a good road trip vehicle. It rides nice. But really, the approach that we took by putting in the barrier and changing the ventilation system, and I'm oversimplifying. There was a few other things we had to do to modify the vehicles as well. But I think that could be done on really lots of different kinds of vehicles. So we at Honda are certainly open to talking with other automakers, with other manufacturers, and sharing our know-how. And I think the more we can do in various municipalities around this country, the better.
And what happens to these vans after this? Will they be offered to the general public, or is there something you have to do to make sure that the next owner, the next purpose feels confident that it's safe?
They're on loan, so Honda's retaining ownership of these vehicles, and that's for a particular reason. As we put in the polycarbonate barrier, there's a side curtain airbag that runs the length of the vehicle. We had to disable that side curtain airbag, so we've approached the U.S. Department of Transportation and NHTSA, and they quickly and kindly agreed to the waiver for this particular kind of use. So they're on loan for a year longer if the city needs them. We're here to help. But when the city is through using them, then we'll need to remodify them in order for them to be driven by an average citizen on public roads. We did go with the leather interior, trying to think about that is easier to clean after each use. So we're just happy to be involved in this program and have this pilot going, and we sure hope we satisfy customers up here.
Okay, great. Thank you very much. For the mayor or Councilwoman Ayers, can you tell us what the amount of the budget cut was, what the final overall budget will be, in terms of $1 billion, $1 billion, whatever it is, and where people will notice where the cuts came? Because certainly I don't think anybody believed there's an extra $250 million in the budget that you could cut without anybody noticing that something's not there now.
So the overall cut between this year, which ends June 30th, and next year, which ends June 30th of 2021, is $348 million. About half of that came from reserves that we'd had. You'll see the cuts in a few different areas. Of course, right now, most city hall offices are closed and you can't get in for services. But the thing that this summer, we won't have recreation programs. We couldn't have brought the children together safely anyway, so the recreation programs will be cut for the summer. And then the biggest loss, I think, that most people will feel is the demolition program is essentially completely halted. And it's going to have an impact on blight in the neighborhoods. And I'm hoping that Councilmember Ayers will help lead an effort between the mayor and the council to come up with a solution for long-term funding for demolition. But people are noticing it already. And I am concerned about the blight in the neighborhoods, but it came down to a choice between that or laying off police and firefighters. And we felt like keeping our services intact was priority one, and we need to come back with a solution to finish the job on Blight. Council member, you want to add to that?
No, I think that you hit the nail on the head there. Obviously demolition, but more importantly, it's operations day to day. So, even with my own team, they're on work share right now. So they're not there. I'm not in the building. So I think that's where you'll see, obviously, you can't get into KMAC. But, I worked in recreation for 8 years, and it's sad to think that we won't have those opportunities this summer, but we want to be alive later on in the summer into the fall, so.
Okay, and what will the overall budget be then for 2021?
The number.
You bet.
I know,
Right around 1.1 billion.
yeah.
Okay. And so can you give me an idea of how much money was in the demolition program that now will be, I assume, just repurposed for other things, or just flat out not spent at all?
It'll be spent basically for other things. So if you think about this, we're losing $600,000 a day in casino revenues because the casinos are closed. We're losing tens of millions in income tax revenue because businesses are closed. And so those revenues would have gone to run police, fire, bus system, et cetera. We're going to cancel the demolition, use that demolition money to cover the shortfalls in the essential operations. And as we've talked about, we've got 2,000 employees that are either on the job 10% of the time or 80% of the time. They'll be brought back as the virus eases. And so between putting the folks on furlough and using demolition and reserve money to cover the shortfalls in the income tax and casino revenues, that basically is the way that we have approached this, and we think it's a responsible way. Now I see Nancy Pelosi has pushing legislation today to help local government, and while we think our problem is bad at $348 million, the city of New York's dealing with a $10 billion deficit. Las Vegas's deficit is way proportionately higher than anybody else's because, of course, the entire city shut down. So everybody in America is dealing with this one way or another. We stepped forward right out of the gate, said, here's the deficit, here's what we're going to do. We're going to act early and decisively. It's a lot less painful to act early and decisively than to dawdle around for a couple of months and then have to make much deeper cuts. And I wasn't sure how council would react, but council got on it immediately, held the hearings immediately, and acted decisively.
And does that deplete the rainy day fund?
There's a statutory amount of $50 million or so that we have to keep, and so we are keeping that. We had put additional rainy day funds that were over and above what the state law required in the bankruptcy legislation. So we are spending the extra rainy day funds. We are not spending the base rainy day funds.
Okay, and then just if you could give me a ballpark figure for how much that was that came out of the rainy day fund, and just a rough figure for how much you would have spent on demolition if we weren't where we are today.
So I laid all of that out in my PowerPoint a couple of weeks ago, and I'd like to tell you that I'm good enough to remember the numbers offhand, but rather than guess and get them wrong, maybe we'll have Dave Masseron get it, or you can look up the PowerPoint I did a couple of weeks ago in this room, and I think the numbers haven't materially changed.
Okay. And in terms of the demolition money, is that all local money, or does that include federal funds that were earmarked for demolition?
The federal money's all been
It's
spent.
gone, okay.
So this was, so the plan of adjustment envisioned $50 million a year that the city would spend on demolition if we ran $50 million a year in surpluses. And because the city has done so well in businesses and people coming back, we were able to fund a lot of demolition in addition to the federal money. But at this point, the federal money has been spent. We've got 20-some thousand houses down and another 10,000 renovated. But all of that is going to grind to a halt until the council and I find a solution.
Okay, and I assume one of the options would be the $250 million bond proposal that you had forwarded. Do you anticipate coming back to that? Perhaps not this year, but in the near
Well,
future?
it better be this year, but two of us agree on it, so you're talking to the wrong folks here. But I am confident that we will get to a solution with council on this relatively quickly. I think there appears to be a great deal of confidence on the part of council toward Lawan Counts, who will be running the demolition program out of the city of Detroit. as it's transitioned out of the land bank, which, I think there were obviously legitimate issues raised. I think it's been restructured, and I think now that we're through the budget, council gets a chance to look at it. I'm hopeful we will come up with a solution very quickly. People just can't sit in these neighborhoods and let the blight start to take the neighborhoods back again. We just can't let that happen.
Okay. And Councilwoman Ayers, in talking to individual council members, there were concerns before they would support cutting their own staff and pay that the mayor's office and other city departments, executive departments, were truly taking cuts. Is council satisfied that that happened? And if so, what cuts are you and your staffs making to help close the shortfall up and feel some of the pain that city workers are feeling?
So I would like to say I was probably one of the first council members to make a definitive statement on what my team was going to do, and which was to shift them to work share.
Right.
I don't look forward to getting any increases in my pay, none of that. To speak to whether or not the council is satisfied, I can't speak for the other 8 people, but I can tell you that I know that they took cuts, his 11th floor folks did. Even the mayor and I, we had conversation about what should that look like. So at this point, I think we've done what needs to be done, but if we have to go back and readdress it, then so be it. But I think we have to be very cognitive in our thought pattern and just watch how things are starting to unfold. But I have no problem with making sure that I feel the burn just like everybody else. It has to be a collective effort. I can't go and say, hey, you take this cut, but I don't have to take it. That's not right. I'm a Detroiter just like you, and we're all trying to get through this thing together.
Can you say plainly that city council members are going to have a cut in salary and that all of their staff members will take a cut too, or is that up to each individual council member and how they spend their budget?
I think it's up to the council members, but at this point, the majority have already shifted their teams as well over to work share, which means that they are actually taking a cut. Depending on how long this goes, you'll see an even bigger cut when it comes, if it goes past July 31st. So, that's where we are right now. Nobody's getting any raises. Everything is frozen. And like I said, I can only speak for me in particular, but if we have to come back and I have to take a cut more than what I've done now, I have no problem doing it because we got to get through it, and it has to be a collective effort.
Okay, so the actual council budgets, because as I understand it, council has an amount of money to spend as they see fit. Those amounts have been reduced
Yes.
as part of, okay, and last question for me, I think, is there any role that council can play in trying to renegotiate contracts with the city and working with the independent agencies that you don't have any say-so over to see that they also reduce their budgets to help share the pain?
Is that a shot at, like, the land bank?
No one in particular, I come in peace.
Okay. Well, we know that we have, with procurement, they have already started renegotiating all types of contracts with their dealings with the city and what that looks like and what it looks like currently and going forward. With independent agencies, in example, the land bank, they have taken a cut as well. And so, again, I think that if that's something, as time goes on, where we know, okay, this looks like it's going to be even more money that needs to be figured out in the budget, then we'll have to address it. We have to be creative with it. But it is something that's going to have to happen if we see that that's fit.
Okay, great, thank you very much.
Thank you.
Okay, Mr. Mayor, we've got a few questions from reporters who are not with us today. First one is off topic from Ken Coleman at Michigan Advance regarding State Rep Karen Whitsett. And he wanted to know if you're troubled by her having met with President Trump and the positive thing that she said about him.
Karen Whitsett is an excellent state rep who was suffering from COVID-19 and feels that hydroxychloroquine helped her, and she expressed that. There is room in the Democratic Party for a whole range of opinions, and I think we need to get friends to stop fighting with each other and pull together right now. We definitely, all Democrats pulling together.
Okay. A couple of reporters have asked about the reports of the activity on Belle Isle in the last couple of days over the weekend, and talk about possibly restricting activities or access to Belle Isle and other state parks, and want to know if you had any thoughts on that.
Yeah, well, I didn't have to wait for reports. I drove this city all weekend. I drove every foot of Belle Isle at least 6 times on Saturday and Sunday. And when you drive the parks, Rouge Park and Palmer Park and Chandler Park, the big parks in the city, we aren't seeing real problems with gathering because the Detroit police are visible. Most of the times I drove through those parks, I saw a Detroit police car. Chief Craig and the police are just regularly in the parks, and when group starts to get a little too big, they go and talk to them and they split up, which has been great cooperation. And in the neighborhoods, when the groups start to cluster, the neighbors call the police and the police are there and they break up, which is how we've gotten through this so effectively without curfews, without closing parks. What I saw as I drove through Belle Isle on Saturday, and really probably till about 2 o'clock on Sunday, there were a lot of cars, but there's no problem with cars gathering. You don't have to have social distancing of cars. There's no problem with the cars parking together. It's what do you do when you get out of the cars? And at least for Saturday and most of Sunday, people were getting out of the cars and they were distancing pretty nicely. What I did not see in the 6 times I was through, there were any state police. And so as Sunday went along, you could start to see what was happening as the expectations were when the police cars are showing up in the other parks and police cars aren't showing up here, you start to get a reaction. But I know Chief Craig has talked to Colonel Gasper at the state police. The Detroit police and the state police have a great relationship. And I'm confident that you're going to see the state police provide the same kind of visible presence on Belle Isle that the Detroit police are providing in all the other parks. And I think it'll be just fine. We just need to have a consistent police presence everywhere, and driving home the point that we all believe in the governor's social distancing order here in the city of Detroit, and it's going to be enforced calmly and consistently throughout the city.
Okay. Ingrid Kelly from Fox 2 is working on a story regarding Airbnb, which apparently has made a statement that they're not going to authorize parties or events in any of their properties in areas where public health concerns regarding COVID prohibit gatherings like that. And they want to know if you had any, if you're aware of it or if you had any thoughts on it.
Well, I have the sponsor of the Airbnb ordinance with us here. You want to discuss Airbnb?
Oh, Airbnb. So any of those hosting platforms, I would hope that they're just being responsible. You know, I've heard of a couple of Airbnb locations that have had more than 5 people, and they were not socially distanced. So that's problematic, but I would hope that as a hosting platform, that they would take the measures necessary to be responsible and to be cognitive of everybody else's health. And I'll leave that there.
Yeah, we don't care if you're Airbnb or not. If the group gathers, the Detroit police will come out and enforce it. They will impose a $1,000 ticket, not just on the individuals there, but on the property owners. So I think Airbnb is probably saving a number of their renters a $1,000 fine by imposing this policy. I think it's a good thing.
Okay, and last question we've got is from Detour Detroit, going back to something you mentioned yesterday, Mayor, about the rate of infection in the tests between city residents and suburban residents. And they're wanting to know if you can elaborate on that anymore. Are these strictly tests that were done at the fairgrounds?
Right. So at the fairgrounds, well, it's true at the Abbott too, but at the fairgrounds, we have run the tests for people in the Tri-County area. We don't turn people away. So we have done probably 6,000 or 7,000 testing of suburbanites and maybe 8,000 or 10,000 Detroiters at the fairground site. And so I get daily numbers. And the numbers are recorded a number of different ways, by age, and they're recorded by geography. But what I can tell you is this: of the roughly 17,000 tests we have done, 27% of Detroiters have tested positive and 26% of suburbanites have tested positive. We are one region, and this virus is all through the region. And you know, you've seen the issues coming out of Beaumont with the hundreds of people infected and the crowding and the like. This has been an issue that's been throughout the city and the suburbs. And, you know, I think everybody should take it equally seriously.
Okay, and just as a follow-up, the reporter's wanting to know if there's any high-level data that might be available or be able to be produced to show how many tests were done from how many of your suburban residences.
So our health director has all of that information.
Yes, and whenever the mayor says that I can release it, then I definitely
So
will.
you can release it today. So we've got it.
Sounds good.
But I get a report card every single morning on the number of tests, positives, negatives, et cetera. They've been steadily coming down. We've been running about 10% positive a day, but if you think about when we started, you have to have a prescription when we started. So we were running around 40% positive. Now, everybody can be tested, and we're running about 10% positive. And this is the number that I'm absolutely certain is the case. 10% of the people in the southeastern Michigan area who do not have symptoms are COVID-19 positive today and don't know it. And that is what is keeping us from wiping this virus out, is that unlike a lot of other infectious diseases, this is being spread by people who don't have symptoms. And until we ultimately get to rapid testing for everybody, it's going to be very hard to contain this entirely, which is why we've got to keep doing what we're doing.
All right. Okay, that
All
was the last question. And so now we can head downstairs and check out the new
All right.
Honda vehicles.
All right. Is Rick
Thanks.
driving?
Happy to drive.